All right, moving on. Thank you so much for that. That was fantastic. So our next speaker is also no stranger to the Cayman Islands. He joined us here for our conference in 2014. It's Dr. Fitzroy Henry, who is professor of public health, nutrition at the University of Technology in Jamaica. He joined there in April 2013 as a professor of public health nutrition in the College of Health Sciences and the School of Public Health and Health Technology. Previously, for 18 years, he was the director of the Caribbean Food and Nutrition Institute, a specialized center of the Pan American Health Organization, World Health Organization, which served 18 Caribbean countries. He obtained his doctorate from the University of London. His professional experience as an associate professor and scientist includes 5 years at Harvard University, 2 years in Nigeria, 7 years in Bangladesh, 2 years at the London School of Hygiene and Tropical Medicine, and 5 years in St. Lucia, West Indies. He has published more than 120 scientific articles as first author on food and nutrition in illness, wellness, and sports, diarrheal diseases, chronic disease, obesity, and public health. He is an editorial advisor to several international public health journals, and for 14 years was the editor-in-chief of the journal Cayman and newsletter Niam News publications. In 2016, he won the President's Award at the University of Technology Jamaica for excellence in research. He was also celebrated in 2016 by the Caribbean Health Research Council for his excellent and sustained contributions to public health and nutrition in the Caribbean. Dr. Henry is going to speak to us today about nutrition, the preface to a healthy life. Ladies and gentlemen, please join me in welcoming Dr. Fitzroy Henry.
Thank you. Thank you very much, Madam Chair. It's really good to be back in the Cayman Islands and good to be back here at this health conference. Let me say at the start that if I stop halfway in a sentence and can't remember what I said, it's a clear case of andropause. I want to thank the organizers also for selecting this topic, or this theme of chapters of a healthy life. It's quite interesting. And when I was asked to talk about nutrition, I tried to figure out where in this book of life we should place nutrition. And I hope you all agree, or will agree, that it should be the preface of this book of life, because it encompasses almost everything that we do. For those who are not convinced, I hope that after the first few slides, you will see why it should be the preface of these chapters of life. What I'm going to talk about here is, well, in fact, it is the preface. 2, I will look at some of the real challenges in the life course, starting from very early in life and moving on. And when I say real challenges, I am speaking about not the imagined or the perceived challenges or the fake challenges, but the real challenges that families face as they attempt to bring up children as they go through the adolescent period and then in adult life. And then I'm going to ask the question, when we look at those challenges, do we need new weapons or we need new strategies? And I hope we can answer that question as well. And then finally, I will look at not what we might want to do or what we should do, but what we must do if we want to address these real challenges. So let's start. The preface. Why is it the preface? Sorry, when we look at early childhood development and the factors relating to them, you see there are several factors there, but the one at the top left is nutrition. And I'm going to argue that that perhaps is very dominant in the whole set of factors that influence early childhood development. And I want to borrow a diagram that came out of the Lancet series by Sally McGregor and her colleagues. And they looked at poverty and its impact in terms of school achievement. And we see it's moving through stress, depression, poor and home stimulation, and then poor school achievement. But poverty also affects nutritional deficiencies through infection to this important box there called stunting, which we all know about. And the poor care and home stimulation also affects stunting, and that in turn affects poor cognitive and motor development, and that leads also on to poor school achievement. For many years, there have been lots of assumptions about what really contributes to poor school achievement. But for the first time in that Lancet series, Sally McGregor and her colleagues doing work in Jamaica, and also colleagues from Brazil and Philippines, they were for the first time able to actually differentiate the contributions of the poverty and stunting. And what they have shown is that the total deficit in learning ability, when we look at stunted and the poor together, compared with stunting only and the poor only, we see how dominant stunting is. In other words, you're even controlling for those who are poor. And when we look at the loss of adult yearly income, which of course is important because that's really where, I guess, the rubber hits the road, we see how dominant stunting is, 22% out of the 30.1. And this is for the first time where they have been able to quantify the contribution of nutrition, particularly low height for age. And we have known this from our studies when we look at brain development. In the normal brain, we have the typical brain cells, but in the stunted brain, we see impaired brain cells, impaired branching in the stunted child. And there is a hidden effect of poor nutrition, particularly stunting, on development. And it's like the iceberg effect. We measure children, we see low height for age, and low weight for age as well. But what we do not see is what's below the water. And that, in fact, is what contributes or diminishes, in fact, the functional capacity, ability to work, growth and development, and so on. So there is no doubt that nutrition is critical to this book of life, and it impacts it on several ways. And it's intergenerational, because when you're in the cycle, it happens to the next generation and the next. And this is a diagram from Guatemala, where they have, well, everybody knows it, but if you look, you can actually improve nutrition of a malnourished mother and child, and you can create a healthy, well-nourished newborn, a well-nourished girl, well-nourished mother, and you can break the cycle. And you can break the cycle in many ways. But what I want to emphasize here is that the best way or the best time to break the cycle is very early in life. Many of you might have seen this diagram, and this also comes from the Lancet series, like Sally McGregor's work that I talked about. The Lancet series done by Cesar Victora in Brazil and others, what they're able to demonstrate is that there's a window of opportunity where we can impact nutrition and make a big impact. And that is in the first 1,000 days of life, starting from conception. the first 1,000 days of life. After that, it becomes much more difficult. So it's important that nutrition is in the preface, because we're talking about how do we nurture that newborn? How do we nurture the pregnant lady? And how do we nurture the newborn? And in that first 1,000 days. Because why? We grow in channels. We don't really realize this. But generally, when we find ourselves at 3 years old, we tend to grow in channels for the rest of our lives. And this has been shown quite clearly for stunted children in Guatemala. This is their height at 3 years. And this is not two cross-sectional studies at 3-year-olds and 18-year-olds. These children were followed, the same families. This is the longest study outside of developing, let's say in the developing world, where families have been followed for many, many years. And they're still following them, by the way. So they're able to follow these families and children from the time they were 3. And what it shows that when they're 18, they are still short. And you see the difference there. And in fact, the weight is also smaller for those who started small. It is very difficult to change channels after 3 years. So nutrition is critical. So if you supplement a child under 2 years, you can get, and this is what they've shown, about 46% higher wages because they earn more later on in life. If you supplement within 3 years, 37%. And again, this is new data from these cohort studies where they're showing how important it is to start early with nutrition. The group that they followed showed a similar pattern, where the earnings for those who are taller is much more. The earnings are much more than those who are shorter. And it is so generally. Of course, I am the exception to that, because I am still waiting to get my increased earnings, but so be it. But what about, I talked about stunting, but what about obesity and cognition? Again, new information, and there's a growing body of knowledge showing that even children who are overweight and obese have cognitive deficits. But in this case, it is thought to be bidirectional. So obesity through low-grade systemic inflammation and elevated lipids or insulin resistance can cause cognitive deficits. And it is also believed that those deficits can, through neurological predisposition, encourage weight gain and become obese. But it's very clear that both the overweight and the underweight can have a severe effect in cognition and children's learning, which of course impacts the rest of our lives. So when we look at the obese or the overweight and obese in Caribbean countries over a 10-year period, we find these startling facts. Underweight has gone down between 2000 and 2010. Whereas overweight, you see what is happening there, it's almost 14%, let's call it, of children in the Caribbean that are overweight. The global average is between 5 and 6%. In the Caribbean, these are children under 5 years of age. And if, in fact, the studies are showing that overweight affects cognitive development, then you see the challenges that we have. So I want to look at some real challenges in infancy. And I want to touch on something that we don't normally think about, and these are some financial challenges. And these are data that I collected last year in Jamaica, and I just want to touch on it for a little while. We looked at the cost of breast milk replacement in the first 6 months, and this is in Jamaican dollars. And we looked at 4 parishes, and on the extreme right, we have the average of those parishes. If mothers use fresh milk to feed a child, in other words, with no breastfeeding at all, she will have to spend, or the family will have to spend 24,000 Jamaican dollars. If they use milk powder, it is a little less, $20,000 for the 6-month period. Now, as you know, fresh milk and powder milk are not recommended by the World Health Organization because of allergies and other deficiencies in them. It's really cow's milk. But they recommend the formula. And if that mother chooses to use formula, then she will have to spend $73,000 for the 6-month period. Now, this may not look like a lot of money to, looking around the audience, I see all of you look very prosperous. So, Jamaican exchange rate when I left yesterday was, I think, 27 point something Jamaican dollars to the US dollar. So that comes out to about $300, let's say, for a 6-month period, which you might think is not a lot of money. But the reality of the Jamaican situation, as I will show you in a while, it's quite a lot. Is that a lot of money? Yes. Even for you prosperous people? In Jamaica, Jamaica is considered by the World Bank to be a middle-income country, but you go and tell my colleagues in Jamaica that they're middle income, and you will see what they'll say. But as you can see, these are real challenges that they face. This is if the mother is not exclusively breastfeeding. Now, the Jamaican pattern is that you exclusively breastfeed for a few months, maybe 3 months, let's say, and then you fall off. You continue breastfeeding because you have to go back to work. There are lots of reasons for that. But let us look at what happens if the mother is partially breastfeeding, which means that they exclusively breastfeed for 3 months, and then they use the recommended formula for about 25% of the remainder because they're partially breastfeeding from 3, 4, 5 months. Then she will still have to spend $10,500 for that formula. If she is not, this is the same figure I gave you just now. So it compares if she is not breastfeeding at all versus if she is partial. Now, moving quickly along, I just wanted to point out, if you use the WHO guideline for the 0 to 5 or 0 to 6 months, it really should be 0 because they should be exclusive. Nobody does that because, well, some do that. It's 15% do that, but because of a number of reasons. The cost going up the scale, 6 to 8 months, it costs $1,400 with breastfeeding. 9 to 11 months, 12 to, so you see how much it is. But the Jamaican pattern, you see what happens there. The cost increases. This is what Jamaicans, if you use the pattern of feeding. It means that they can save a difference of that if they follow the Ministry of Health and WHO recommendation. And if you actually cost it out in terms month by month, this is per month, but if you cost it over the whole period, it's $58,000 can be saved if they follow the Ministry of Health recommendations. Many mothers don't know this. They go and they buy the formula and it's, $600. I can afford that now, but nobody really sits down and calculates it to figure out that you're actually spending $58,000 when you don't need to. Now, as I said, the $300 might be considered a small amount. But when you look at the salaries in Jamaica for different categories of worker, that actually turns out on the 4 period to be about 41.4% of a minimum wage earner. A clerk, about 23%, a registered nurse, that's 8%, I think, and then middle-level manager, 6%. So you see, for the lower income persons, if they had to, the cost of feeding is quite a challenge. And this is what I'm calling a real challenge that mothers face. When we look at the number of children in Jamaica that are under 4 years of age, about 208,000 children we have in Jamaica, it really comes up to $58 billion. If you use the Jamaican pattern, it's $71 billion. This is over a 4-year period. So basically, it's $12.2 billion if you do not follow the Ministry of Health or the WHO guidelines. This is the financial reality of young child nutrition. But it's not all about the cost of the food, because we know their financial barriers also affect intellectual development that we just discussed, motor development, infant morbidity and mortality in some cases, and of course, childhood development. Now, that financial dilemma is also comes into play when a child wants to go to a childhood institution, early childhood institution. We have several thousands of them, as you can imagine, in Jamaica. And when you look at the term cost, which is like a 3-month cost of feeding a child from the data I just showed you, it comes up to about 16,000 Jamaican dollars for a 3-month period. The cost of care and training in a government early childhood institution is $3,000, which means that family has to find an extra 20% of the cost. I'm just referring it now to the cost of feeding. If they use a community childhood institution, they have to find an extra 27%. These institutions, this is without feeding in institutions, okay? So in addition to feeding, this is an extra cost. If you look at a church institution in terms of early childhood institutions, we have to find another 35. And if you use the private early childhood institutions, they have to find 171% of the cost of feeding. This is the real challenge. What the implication is? The implication is that, first of all, as you said, it's very expensive to feed the child. But if you can't even feed the child, how are you going to send this child to an institution where, and I can imagine the difference between the private, the church, and the other institutions. So it means that there are only certain institutions available for certain families. The social implication of what I am presenting here are very profound. And it's like that cycle that I showed you from Guatemala. And these are real challenges. We need to break that cycle. We always talk about nutrition, but we have to address these issues. Who is going to address them? What about later in childhood? There are also financial implications there as well. Now, which do we choose? And I'm not going to look at you at a break, you know. I know some of you are going to say, take the left and then the right, right? But which do we choose, and what does it cost? Last year, we did another study on this in Jamaica, and the question is, do healthy diets cost more? We have lots of anecdotes about this. But you're saying yes, and you haven't done the studies. I think you're just doing it from what you see in the supermarket. But there is a general feeling that healthy diets cost more. And those healthy diets, what is even more important, can the poor afford them? These are the questions of my study. It's not for you to answer. Okay, without going into too much details of the methodology and because of time, we did it in 6 sites in Jamaica, in blue. And we did ranking of foods, okay? High in complex carbohydrates, high in dietary fiber, the usual low in cholesterol, low in saturated fat, mono, polyunsaturated, high in iron, low in sodium, high in potassium, low in calcium. And for each food, they got a score, and then we put the scores there, so we had a linking and a ranking of the foods. What the study showed is, and when we look at it by food groups, the highest ranked foods are, for example, in the staple group was $122 compared with $100. So there is much difference between the high ranked staples and the lowest ranked staples. The differences really came in the vegetables and the food from animals. And overall, you see there was about $88, 87 point something, $88 difference overall between the health. In other words, it's $88 Jamaican dollars more to get a 2,400 calorie diet if you choose healthy options versus the other. Now, I found 27 studies across the globe from the literature where they did similar, and the average was about $1.47 more for healthier food. So you're right. It is more expensive, but in Jamaica, at that time with the exchange rate, it came up to about $0.78 US compared to the 1.47 we found in the other studies. So it was more expensive. But I want you to look at the highest ranked foods and that $490, which is the amount for a 2,400 calorie diet. Because the other thing we wanted to do, this is what families generally choose. But is this the cheapest way to get a balanced diet in Jamaica? Some people think that $490 is not a lot. But in fact, to get the balanced diet, we looked at the cost of diet, which is what I'll show you there, the $490. And when we looked at the foods and we had a computer program which generated the cheapest possible way, you can get a cheaper diet for about 270 Jamaican dollars. The cheapest way. We're having variety of foods as well in each one of the food groups. So a family of 3, in other words, multiplying 270 by 3 and then multiply it by 7, it's about $5,670 for a family of 3, the cheapest way to get a balanced diet in Jamaica last year. And guess what? The minimum wage per week is $5,600, which of course we submitted to the Ministry of Finance, and I'm not saying because of this, but it's one of the factors that led to the increase in minimum wage in Jamaica. But we use this for all kinds of poverty and food insecurity studies and so on, this methodology. But it just shows you the challenge that families have, and this is the cheapest way. It's not if they had a free reign of choosing what they want. And looking at it in different families again, you see what is happening there. 106%. It varies from parish to parish, but if you look at the minimum wage, it's 106% of the minimum wage to get a balanced diet for a family. Cashier, it's 59, registered nurse, 20, and for a mid-level manager, 10. Is it 10 or 16? So we see the challenge that persons in the lower income groups face in gaining nutrition so that we can start a healthy life in this book of life, this chapter. The financial challenges are for both undernutrition and overweight. What about adolescents? Let's move up now. We look at the 11 to 13 years old, and we see at the bottom 2 rows about 27% of boys and 33% of girls are either overweight or obese in the Caribbean. This is 1 in 3. This is early adolescence. This is where we're going in the Caribbean. Cayman is not a part of this, but I suspect that they will be somewhere within that range. When you look at WHO figures for girls over 15 years with the highest overweight or obesity, 191 countries, we see the figures here and they rank them 1 to 7. Nauru, 82% of girls. Tonga, 81% of girls. and coming down to Kuwait. And we may think, well, this is in the Middle East and this is in the Pacific and no concern of us. But when we look at the next 7 ranked countries, some familiar countries appear. So out of 191 countries, we have Barbados, Trinidad, Dominica, and Jamaica ranking among the top 14 countries in the world in terms of girls being either overweight or obese. We have a problem. We have a major problem. I think you're aware of it, but these numbers just bring it to the fore. And when we look at WHO figures again for over 30 years old, it's not the top 4, but we see the Bahamas and, as I said, Cayman. Even Haiti has 19%, which is down at the other end of the scale. We do have a major problem, which means that we have to look at some real challenge, some real bold moves to address this issue. So is nutrition the preface? Yes, because you see there in the scheme of things, the man is obese, the woman is obese, the children are obese, and the little cat down there is also obese. All part of the family, same environment. So nutrition starts and affects fetal and maternal health, infant health, early school health, adolescent health, adult health, and also older adult health through various mechanisms in black. So when we look at nutrition and death in the Caribbean, we see that 23% of deaths come from heart disease and hypertension. Cancer, 21%. Diabetes, 13%, and moving fast, rising fast. Stroke, 10%. Injuries, intentional and unintentional. Crime, violence, and all, 7%. HIV, AIDS. The ones in green are obviously related to nutrition. So we have about 67% of our deaths that we can do something about. Nutrition is related to AIDS, but it doesn't prevent it. It's part of the treatment. But the others, we can really make a difference. The top 4. Is nutrition the preface to a healthy life? I hope there are no doubters at the moment. It's the most important underlying cause of death in the Caribbean. When you look at the death certificates in the Caribbean, you don't see obesity. What we see are those things that I mentioned just now. But this is the underlying cause. When we look at the trends over the several decades, we see what is happening with obesity. Male-female divide. Notice the last decade, how the men are catching up and catching up fast, particularly with central obesity, which relates very much to the metabolic syndrome. And we know the risks of obesity, or do we? We certainly have major risks of obesity, and usually, everybody is happy when we have overweight situations, but we don't really appreciate the risks. But if you think of the slide just now showing the pattern, and we look at deaths from diabetes, this is what we have in the Caribbean. And the male-female divide is still there. And when we look at deaths from hypertension, we see the pattern. So there are severe risks. The one in this chapter of life that we don't talk about in terms of nutrition is cancer. Because there are some thoughts about cancer, and there are those who believe it, nutrition has little to do with it, but it's not so. When we look at cancer in the Caribbean, these are the countries that reported to WHO, so I don't have all of them. And you compare it on the right. This is the average where we have Caribbean compared with United States and Canada. And we see that there are some countries in the Caribbean that have higher rates than North America. So it's not a their problem, it's our problem in the Caribbean. And if we break it down, I didn't have time to go through all of them in terms of breast and prostate. You're going to see some of them way over North America. Cervical cancer that Dr. Mackenzie was talking about just now, it's really inexcusable in a sense, because screening, early testing, HPV vaccine, these things are readily available. The others we can do something about, but I'm going to talk about some of the challenges we have with nutrition in the second half of this. When we look at the causes of cancer in 1980, we see at the bottom smoking, 30%, and diet, make no mistake, 35%. Over a 30-year period, we found new causes of cancer, those in red, at 2010. But guess what? Smoking is still at 30%. Diet is still at 35%. There's no doubt that diet, we know about diabetes, hypertension, and so on, but we don't often talk about how preventive nutrition can be for cancers as well. So we have obesity leading to the chronic diseases and, of course, causing deaths. And we know that nutrition can play a very important part directly on obesity and also on the chronic diseases, as you see there. And what the studies, research has shown, the evidence shows that it can actually make an impact of that amount with physical activity in preventing obesity and preventing most of the chronic diseases and postponing deaths by the amount that you see at the bottom so people can live more healthy and productive lives. No doubters about the importance of nutrition. So what are the real challenges? Is it in the health sector? What can we do in the health sector? I know maybe lots of persons here are from the health sector. But what I want to put to you is that the health sector can only do that much. And we have to look at some new ways of tackling this problem. What I tried to do in the first half is show you the enormity of the problem. And I want to address now the enormity of the challenge. How can we lead to a healthy life in this book of life when our domestic agriculture policy, and you have an agriculture conference next week here, I hope they address these things. Oh, I hope so. When our domestic agriculture policy lacks adequate incentives for the production of fruits and vegetables, can the health sector do anything about that? Our food imports encourage consumption of high-energy dense manufactured foods. That's not a health sector problem. Many school canteens and vendors promote high-energy dense foods with little nutrient value. It's not in the health sector. These are the major challenges we face. Our local and cable networks heavily advertise fast foods, especially on children's programs. I'm hearing yes in the audience. But I hope that's not a yes that health sector can deal with that. We can take the lead in encouraging other sectors to act, because the consequences of the problem come to the health sector. But the actual prevention of the problem is elsewhere. This is why we need a multi-sector, multidisciplinary approach, which is what I will conclude with. The cost of healthy options is unaffordable to many. I discussed that, especially, that's what I spent time discussing. Not really in the health sector, but these are the nutrition challenges. Agriculture, civil society, education, health has to play a role. And you notice I put big there, food industry. And let us make no mistake that the food industry has a major role to play in this. And the question is, why should the food industry get involved? Their business is profit. Their business is selling their products. How can we get them involved? Why should they be involved? We would like them to be involved. So there's a business challenge when we look at nutrition. And if we're talking about business, who better than Bill Gates to give advice? And Bill Gates, and I want you to Google this because it's very interesting what he said. He has a concept of creative capitalism. And I only have a small quote here from him because of time. He says, a system where governments and business work together to stretch the reach of market forces so that more people make a profit and also ease social problems. This is what he considers to be creative capitalism. He goes on, he says recognition. And that recognition can come in government and other people giving incentives to the food industry, in our case, so that they can do certain things. We'll come into that in a while. But he says recognition enhances a company's reputation and appeals to customers. It triggers a market-based reward for good behavior. You agree with him? But does the food industry agree with Bill Gates? And the answer is a clear yes. Yes, they certainly agree with him. And if you look at the literature, you can go to Procter & Gamble, you can go to Unilever, you can go to Nestle, Coca-Cola, and in their documents, they all basically saying the same thing that Bill Gates is saying. But I want to focus on one because it has been in the news this week. I don't know if you've heard about it, but it's been in the news this week. So I'm just going to focus on PepsiCo. You know, PepsiCo is one of the largest companies now in terms of beverages, and they've now moved into snacks and other things. It's not just Pepsi, okay? And Indra Nooyi, who has been the CEO for many, many years, she basically agrees with Bill Gates because she says blind pursuit of profits is untenable. She goes on, if communities suffer as a result of a company's action, those returns are not sustainable. She says today profits are inextricably tied to the prosperity of its customers and consumers. Right. She says we are working to improve the nutritional profile of our products and offer a wider selection of nutritious foods. These efforts do not come at the expense of profit. And more than ever before, profitability and sustainability are synonymous. That's performance with purpose. And she says PepsiCo needs to reduce the sodium, added sugars, and saturated fats in our food and beverages. And we engage in others in the food and beverage industry for collaborative solutions. What have they done? PepsiCo has set a goal for 2020. And that is to reduce the average amount of sodium per serving in key global brands using 2006 as their baseline. In 2014, they have removed 1,800, and this is not advertisement, I'm just putting the facts, okay? 1,800 metric tons they have taken out from food brands, which is about 10%. This is in sodium. And their challenge, they say, is consumer acceptance of reduced sodium products. In terms of added sugars, they have, in 2014, they have removed 434,000 metric tons from USA and Canada, but there's an increase overall because India and China basically swamped that. Research and development for sweeteners and flavors, lower in calories. So that's the challenge they're having with added sugars. And the third area for PepsiCo for the 2020 goal is to reduce the average amount of saturated fat in key brands by 15%. In 2014, 5 of 10 countries met this target. They removed 1,600 metric tons of saturated fat from their products. there's a 2% reduction. Their challenge is accessing healthier oils in the market with high volume growth. Is this too good to be true? That's a major advance. But last week, scientists from Boston University in the School of Public Health, they actually did some research on PepsiCo and Coca-Cola. And not that they just showed that between 2011 and 2015, Coca-Cola and PepsiCo sponsored 63 health organizations, 19 medical organizations, 7 health foundations, 5 government organizations, 2 food supply groups. And you might say, well, what's the big deal? Why not sponsor? What's wrong with sponsoring health organizations? But we know that the impact of these companies is for brand awareness, positive brand associations, enhanced corporate image, and the influence of the health impact of their product. So this came out in the journal last week, and they went on. They said they were antagonistic to public health in 28 of 29 cases. Antagonistic to public health. So on the one hand, they're reducing, and I believe what they said, they're taking all these tons of sugar, salt, and whatever out of their products, which I think is good. But on the other hand, they seem to be making an impact. But this is much more damning, because this is really being antagonistic now to public health. This is the challenge we have in nutrition, let's face it. We cannot avoid it. We have major challenges, and we have to understand what is going on in our local situation by looking at the global sphere. In 2011, they are antagonistic to marketing food to children. 2012 and 2015, genetically modified organisms labeling. These are court cases that they are fighting against. 2013, restrictions on junk food. 2014, marketing soda and junk food in schools. Well, what has happened is that some of these organizations are, I don't know if it's embarrassed or what, but they are pulling out of these types of sponsorships. What we have is the Academy of Nutrition and Dietetics. They have withdrawn their contracts with these food companies. The American Academy of Pediatrics has done the same. American Academy of Family Physicians, American College of Cardiology. And the University of Colorado returned $1 million in sponsorship. So there's a turning of the tide among those who are contracted with these organizations. So 2 days ago, the CEO of PepsiCo, the same lady, Indra Nouri, she came out, and I said, you might have seen this. This is just this week. On October the 18th, she has an agenda now for sustainable agenda for 2025. And she says by 2025, 2/3 of the 12-ounce beverages will now contain less than 100 calories. Okay, the 12-ounce beverages. And 3/4 of foods will contain less than 1.1 grams of saturated fat per 100 calories. So it's even a further reduction, sort of when pressured by the media about this finding in terms of their sponsorship and giving with one hand and taking back with the other. The question is, will they stop resisting public health initiatives in court? And I leave you to judge that. And the jury is still out on that. But that's where we are. That's where we are. The question, is this a losing battle? You think it's a losing battle? No? Yes? But can we win the war? We certainly can. I think we can. But what we have to do at the local level, that's happening in the courts with PepsiCo and Unilever and all of that. But for this conference, I think, and for us in the Caribbean, we have to figure out what is it we need at the local level. What can we do ourselves? They can promise all kinds of things they can do, but we need to take action at the local level. So we have to find some nutrition targets in the Caribbean. And we are proposing that for fats and oil, should be no more than 10%. Right now it's at 14. We need to bring that down. Food from animals should be 15%. Right now it's at 20. For sugar, we should be 8%. Where do you think we are? 20 years ago, we did not realize how important sugar is to obesity. It's very, very important. We need to bring sugar down. Fruits and vegetables, we should be at 14%. Where do you think we are? Legumes, 6%, we're at 2%. And staples, 47%, we're at 39%. So when we look at the pie, that's where we are, that's where we need to go. And this involves making the foods available, accessible, and making sure we consume them, which is really about food and nutrition security. So coming to the end now, the question is, what do we need? New weapons? Or do we have to change the strategy? Change the strategy, I'm hearing. Okay. Well, this is my favorite diagram. If we want to move from poor nutrition to good nutrition, it's like moving that man pushing that boulder up a hill. And as he pushes it towards good nutrition, the resistance is getting heavier and heavier from all the things I'm talking about. What we have been doing in the past is a lot of training through the Ministry of Health, training our workers to go out there and tell people how to eat and all the guidelines and so on, which of course are important. But the more we push, we're not really getting to good nutrition. What we need to do is to flatten the hill. We need to change the environment. Change the environment. What we mean by that? We mean that we must move from research to public policy. These are the stages that we usually should take. The evidence, we have all the recommendations of how many grams of this and how much weight and so on and so on. That we already know. WHO and to some extent FAO, they've been very good in putting that out. And we have our local data to complement that. We've been helping the individual by treating clinical care and health education and so on. What we need to do now is to change the environment. This means flattening the hill. We flatten the hill by having standards and guidelines so that wherever it comes from, we have our local standards and guidelines and we adhere to them. We have to get industry involvement, particularly the food industry, and we have to look at legislation and policies and regulations so that we protect the public. And I'm going to end by talking about these three in terms of where we should go in changing the environment. So national guidelines and standards. Oh, before I go that, let me also put this out there. Health staff training, public education, fiscal incentives and disincentives. In the past, we have done a lot of the top. What we need to do in the future is more what is in red at the bottom, those regulations and guidelines and standards. So are the main problems in the health sector? We have some problems, but I will argue that a lot of the challenges that we have in nutrition are not in the health sector. And we have to find ways of dealing with the economics, the education, the food processing, the marketing, and so on. So, the guidelines. We have developed guidelines in several of our Caribbean countries. This is the breadfruit in St. Vincent and the Grenadines. They have developed their guidelines. In St. Kitts and Dominica, they have developed their guidelines. And of course, the different icons relate culturally to what is acceptable to them. Bahamas, they have the drum. In Guyana, the stew pot. in Nutmeg in Grenada, St. Lucia. Antigua isn't here, but Antigua has developed their guidelines. In Jamaica, they use the plate, and they have developed the most recent one last year in Jamaica. So we have done some work in terms of guidelines. What about industry involvement? We need to focus on the food industry in the Caribbean, and of course, those that have extensions elsewhere. Product reformulation. What PepsiCo is doing, or said they're doing, and hopefully doing. We need to look at our local industries and those that we import so that we have less sugar, fat, and salt in our products. Marketing, what are we doing with that? Labeling, a big issue. Communication and advocacy. These are big areas that I don't have time to go into each one, but just going to touch on some things that have been going on. In terms of salt, other countries have done this. France, Finland, Argentina, Brazil, led by government, they have been able to reduce salt in James Hospitalis talked about Ecuador last night, and I think some other country, Bolivia, that have recently done that. In the Netherlands, it was led by the food industry, and they have been able to reformulate their products for health of the community. The NGOs led the move in Poland, Slovakia, Australia, and New Zealand. In the Caribbean, at least in Jamaica, we are trying to combine. We have a committee that we are working with both private and public food industry and government NGOs and so on, trying to get agreement on how we can reduce these products. In Finland, they have been able to have an overall reduction. In the UK, there was a fall of 9 grams. We know about the influence of marketing. Are we really powerless against the marketing? Marketing of food to children. In Canada, they have been able to put this in law, section number 248 of the Consumer Protection Act. Prohibits marketing to children. In Norway, Regulation 153 of the Broadcasting Act. In the UK, there's a communications regulator. In Sweden, Section 7 of the Radio and TV Act. In Facebook, that we don't realize, ads must comply with local laws and licensing and approvals. In the Caribbean, I'm told that we can't do anything with the cable industry. There's nothing we can do with our local television because of this and all kinds of things. Other countries are doing it. They recognize the challenge, and you saw our figures are higher than many of these other countries, but guess what? We're not doing anything about marketing children. When we have the figures for 11 to 13-year-olds, with 1 in every 3 girls being overweight, we have to do something. So these are the real challenges that I'm talking about. They're not easy, but they're real. In 50 countries, they regulate TV advertising aimed at children. Australia bans food ads for children less than 14 years. Netherlands bans ads for sweets for less than 12 years. Sweden bans cartoon characters to promote foods to children less than 12 years old. In the USA, only in terms of time. Food ads may take up to 12 minutes per hour during weekdays, but only 10.5 minutes per hour during weekends. But at least it's a start. In the Caribbean, we're not doing anything. Recent taxation on sugary drinks. Controversial area, but it's an area we need to move forward in terms of advocacy. In Finland and Norway, they have been doing this for a long time. Recently, France and Hungary in 2012, they have brought in taxation. 2014, Mexico did it. 2015, Chile, and 2 countries in the Caribbean, Barbados and Dominica, have introduced taxation on sugary drinks last year. 2016, Belgium, Yesterday in the newspaper, I saw that Portugal is planning to do this in 2017. Britain was supposed to do it last year. Mr. Cameron had his chancellor make this announcement. It was supposed to start in October last year. But everybody said that that is going to push Dave Cameron out of office, but Brexit did it instead. The new Prime Minister says that next year, Britain is going to reintroduce this tax on sugary drinks. India, Philippines, Indonesia, they're all considering it. What about others? This is Barbados. They have, as I said, they have recently, Pine Hill, they have increased their taxation on these in Barbados from 5.7 to 6.1. It's a 7% increase in the price. The World Health Organization recommends a minimum of 20% increase before you can actually see reductions in consumption. It's like tobacco. It has to be between 65 and 75% of the tax before people start feeling it and stop smoking. Not the addicts, but others. So WHO, through all kinds of simulations, they recommend a 20%. In the schools, again, from changing behavior, near done. In settings to changing the environment to enhance behavior. That's what we need to do. And the concept is focusing on the student, and we have a whole range of activities that we need to do in the schools. And finally, in terms of legislation, we shouldn't forget that the law is a friend and a powerful instrument in public health. We see it in terms of immunization. The law is very, very powerful in terms of what needs to do before you go to school. The seatbelt, lead exposure, smoking, alcohol control. What about diet? Why is diet left out? We certainly can do something. And these are some policies that I am projecting we can make quick changes on in terms of the legislation and strategies to improve health in the region. So in conclusion, there is no doubt that nutrition is a preface to healthy life. At the start, I talk about implementing policies to enhance early childhood nutrition. I talk about the financial barriers that exist in early childhood nutrition. We need to revamp the approach to schools nutrition. Every Caribbean country has a school feeding program. But when you look at it or try to evaluate it, you see major deficiencies, but it's an opportunity to do something there. We need to change the environment. We look at financial barriers. They are clearly present, but I will submit that the policy barriers are even more profound. So is nutrition the preface? Yes. Are we bold enough to turn the page into that book?
Unfortunately, we don't have time for Q&A, but I know that Dr. Henry will be circulating close to the healthy options at the break. So I just want to thank you so much for a very informative and thought-provoking presentation. I think it's highlighted a lot of opportunities that we have to try and address this, and I think that we will all agree that nutrition is indeed the preface to a healthy life. Thank you so much.
Thank you.